Hey guys, welcome to this edition of Trish Standley TV. We're going to be talking about heart health alongside menopause. We have the wonderful, lovely Dr. Olubi who's going to be here sharing her knowledge, and she has a lot of it, guys. You do not want to miss this episode. It is very informative. And I also want to thank my co-host, none other than Jennifer Heigenberger, who's going to be hanging out co-hosting with me today on this particular topic. Make sure you stay tuned.
Trish Standley TV Show.
Welcome to Trish Standley TV. Today we have a wonderful guest and co-host with us today, but we're going to be talking about menopause. We've been doing that a lot this season, and we have to round off that conversation with the wonderful, magnificent Dr. Olubi, who's here as our guest on today. But before we talk to her, I have to bring back my girl, my friend. She's been here before. We've interviewed you, I think, in 2021, 2022, somewhere around there. None other than Jennifer Eichelberger.
That's it.
I'm horrible with E's, and so I was like, sometimes I do the E. But Eichelberger, you have been doing a lot in the community, continued. Just share with us what's going on with you, what all you have, because you got your hands in a lot of things right now before we proceed in our interview.
Okay, thank you. Yes, I'm an author, and I think you talked to me about my book.
Yes.
My latest book is Self-Care, The Vital Art of Nurturing You. So we know it's important to take care of ourselves.
Yes.
I'm also a part of Toastmasters, which is teaching the leadership skills and public speaking skills. And I'm part of Lady of Distinction, TLOD, the North Atlanta chapter. And one of the things we talk that we reach out to are women, make sure that women get the proper information for health and things like that. And we do things in the community around Christmas, around Thanksgiving. We have back to school drive. So yes, that keeps me busy.
Yeah, yeah. You stay busy. We follow each other on social media. But what better way or segue to introduce and meet Dr. Olubi, because she is a cardiologist. And you talked about the women groups that you work in. You need to have her in there. So she can talk about, because this topic today blew my mind. I had the pleasure of interviewing you for a magazine, so I have a little bit of behind the scenes knowledge. But can you share with our viewers who you are? I introduced you who you are, but your specialty and where you serve as far as your patients.
Okay, so thank you for having me. I appreciate the opportunity to talk about heart disease in women, particularly with menopause. So I'm a preventive cardiologist with Piedmont Healthcare, Piedmont Heart Institute. My practice area is in Piedmont Fayette, Piedmont Noonan, and Piedmont Atlanta. And I have a special interest in women's heart health.
Now, what caused you, as a beautiful little girl, decided when I graduated from high school, I want to be a doctor, but when you go to school, you go to medical school, what made you focus in on the heart in this particular area?
So I think for me, it really started with, my father's a physician.
Okay.
And I was very, very close to my grandmother when she was alive. When I was in high school, I was in boarding school. And she lived very close to my boarding school. And, you know, when you're in boarding school, you can't have visitors, you can't, you know, you're there by yourself. But because she lived so close, she would walk. She was older, but she would walk all the way to my school. And she'd wait for someone to come to the gate, and she'll say, hey, do you know this person? And then she'll bring some treats. So I was really, really close to her.
Yeah.
But she had diabetes, and in her later years, she developed congestive heart failure. And so when she was dying, it was very, very hard for me, and I couldn't figure it out. So I started reading about the heart. What can we do to save her? So that was where my love for the heart, you know, started, because I really, you know, she was that close to me. I was, you know, so I was really devastated when she passed, and I said, you know, I really want to learn more about this disease that killed my grandma. So I wanted to go to medicine, but even when I was doing rotations, I was always interested in the heart, how the heart works. And when I started learning more about cardiology, it made sense. You know, it just made sense. Everything just came together. And that's really why I went into the field of cardiology, primarily for that reason.
Well, we're glad to have you there. The more that we are able to go in and look and see ourselves reflect back to us, I feel makes it so much easier. I know you had a couple of questions regarding just general simple questions about menopause period. Share your questions.
Sure. Tell us about exactly what menopause is, because that's something that we grow up hearing, menopause, but do we really know what it is? So share with us exactly what menopause is.
So menopause is the permanent cessation of menses, and is usually confirmed after you've had 12 consecutive months without a period.
Okay.
And that is the actual definition.
Has to be
of
12 months.
12 consecutive months
I see.
without a period. So it can't be spotting here and there, bleeding here and there, but 12 consecutive months without a period, then that's when menopause is confirmed.
And so if you, and this is one of the questions I asked, so if I go, say I go 10 months with no cycle, and on that 11th month, I get a cycle, I have to start all over with 12 months again?
Consecutive months. And if there's any concern or you're not sure, menopause is usually a clinical diagnosis, so it's based on, the 12 consecutive months. But if there's some, lack of clarity, there's some, testing, blood testing that you can do for that. The gynecologist would do that. But usually it's really a clinical diagnosis, and it's those 12 consecutive months.
Okay.
Okay, so there is a test that the doctor can give.
There's some blood work that they do, but it's primarily clinical. And you only do the test if you have lack of clarity about whether or not that person is truly in menopause.
I see.
Oh, so the patient cannot request it?
The patients can, and the doctors will do it if they're not clear, but most doctors, by the time you have the 12 consecutive months, you are in menopause.
Okay,
Yes.
I see.
Yes.
Okay. And what age does it typically start?
So the average age of menopause is about 51 years of age. But we have what we call early menopause, and then we have premature menopause. So menopause is considered early if it occurs before the age of 45, and it's considered premature if it happens before the age of 40. And we know that women who have early or premature menopause have increased risk for cardiovascular disease.
Really?
So it's very, very important that they're aware of that. And many women don't know that.
When it starts earlier?
Yes, so if they have early, and black women are more susceptible to getting early or premature menopause.
Okay. Is there any specific reason, or is it
There's
we just the lowest on the totem pole for everything?
Yeah, there's a lot of thought as if your mother went to early menopause, but it's really hard to say what the reasons behind that are. Women who smoke also have risk for premature menopause or early menopause, and of course you can get early menopause or premature menopause from not natural reasons, from surgical menopause. If you've had a hysterectomy, oophorectomy, that's a form of early menopause. And some women who've had cancer and have had radiation therapy or chemotherapy, that can put them into early menopause as well.
Okay.
Okay.
I had a hysterectomy. I was in my early 30s, but it wasn't a full.
So they
So
kept
I still
your
have my ovaries.
Exactly.
Yeah.
Okay.
And so I didn't really know what was happening to me because, like I was sharing with you off camera, my mother didn't even really talk about even. I don't ever even remember my mom saying, "Oh, I'm having a hot flash."
Yes.
But when I asked her about it in hindsight, she's like, "Well, I really didn't have a lot of symptoms, to complain about." I'm like, "Why couldn't I get some of that?" But she also had a hysterectomy, but she was older.
Yes.
And so I really did not know what to expect. I don't think I had any of the premature stuff, but that perimenopause. Can you break down, because you talked about perimenopause, regular menopause, and then post-menopause. What, Lord, do we have to expect in post-menopause? But break those three down for me.
So perimenopause are those years coming up to that permanent cessation of menopause that I talked about, and it can be anywhere from 2 to 7 years.
Okay.
Some people would say 2 to 10 years, and that's when you begin to experience some symptoms, and we'll talk about that, later. And then postmenopause is after that 12 months of lack of period. That is your postmenopausal period.
Oh, okay.
And I would say, if you think about it, if the average age of women now is about age of 80, so we spend 40% of our lives in that postmenopausal period, and that's when we have that heightened risk of cardiovascular disease.
Okay.
So it's important that we take charge of our heart health because of that.
Yeah. And so you mentioned that there were some symptoms that align with heart health issues that we naturally experience through menopause. Can you share some of those symptoms?
So when you look at the menopause symptoms, we have what we call vasomotor symptoms. Those are the hot flashes, the night sweats, and then you have the genitourinary symptoms. Those are the vaginal dryness, painful sex. Then you have the psychosocial or psychological symptoms, which is mood changes, the depression, anxiety. We also talk about some other things that you have increased risk for, things like osteoporosis, cardiovascular disease. So those are all the symptoms that you will experience with menopause. So when you talk about those vasomotor symptoms, things like palpitations, sometimes you can feel extremely fatigued, you can have some shortness of breath, or you may have chest pains. Those overlap with cardiovascular symptoms. So when you have those symptoms, you might think, oh my goodness, when you have the palpitations, you might say, am I about to have a heart attack, you know? But if you have those symptoms and you feel them, and they're concerning, or they're persistent, or they're new, it's important that you do, seek care and get it evaluated, especially things like chest pains, or if you have, pain with exertion or shortness of breath. It's important to get evaluated to make sure that you're not having cardiovascular risk factors or cardiovascular symptoms. But they do overlap. And, of course, in my practice, I see a lot of patients who come in with palpitations and hot flashes, and they don't recognize that this is actually, menopausal symptoms, and unfortunately, sometimes you have, they've gone through tons of testing for cardiovascular, they've had all these things done, and nobody seems to think about the fact that this could be symptoms of menopause or perimenopausal symptoms.
It's wild. I mean, you have to really, really be engaged with your doctor in this. Is there a way as a patient that's in postmenopause that we can ask or request for that to be checked? Like maybe in our annual, can they check the condition of our heart? Is that something, I mean, they listen, put the, stethoscope, whatever you call it, to your heart.
EKG or...
There's no way to check your heart health?
Well, actually, this is very important. I'm glad you asked that question. I think it's important that, we realize that heart disease is the #1 killer of women.
Yes.
So 1 in 3 die each year of heart disease. And a lot of people don't realize that. Do you know that heart disease kills more women than all forms of cancer combined?
Even breast cancer?
Even breast cancer. So if you think about it, they say 1 in 30,000 will have breast cancer. 1 in 300,000 will have breast cancer. 1 in 30,000 will have heart disease.
Wow.
So, and it's not just breast cancer, it's all forms of all forms of cancer combined.
my goodness.
Heart disease kills more women. And only about 56% of women know that. Most people think breast cancer is the #1 killer. So I think it's extremely important that we have that conversation with our providers about our heart health, and we should be screened for heart disease, especially around the time of menopause, because during menopause, that is the time of accelerating cardiovascular risk. Menopause is a time of accelerating cardiovascular risk, and that's because before menopause, estrogen is protective for cardiovascular health. So before menopause, estrogen is protective. But after menopause, during that menopause transition, as the estrogen levels begin to decline, you start to see certain changes. So for example, your bad cholesterol, which is what we call your LDL cholesterol, begins to go up. Your blood pressure begins to go up. You also see changes in your body composition. You start to see abdominal weight gain. And we all know that abdominal fat increases your risk for cardiovascular disease.
Wow.
So that's why during menopause, all these combined risk factors is what causes the risk for heart disease to increase significantly.
So the lack of estrogen can cause the blood pressure to increase?
So basically, let's think about what estrogen does for your blood vessels. So on your blood vessels, you have estrogen receptors. And what estrogen does is it maintains the flexibility of the blood vessels. And it also helps to support your good cholesterol. So when you now lose that estrogen, what happens to your blood vessels? Because it's no longer flexible, it becomes stiff. And with that stiffness comes increase in blood pressure. And with that stiffness, you also get issues with increased risk for plaque formation. And with plaque formation, you have increased risk for what we call atherosclerosis. And atherosclerosis, have you heard of the word hardening of the arteries?
Yes.
So when you don't have estrogen, you have increased inflammation, increased stiffness of the arteries. They don't dilate as well. You get atherosclerosis with the plaque formation. And then when that plaque builds up in your arteries, it can clog your arteries. It can lead to a heart attack. If it clogs the arteries that go to the brain, it can lead to a stroke. So that's the role that estrogen plays when it comes to your blood vessels. Flexibility, elasticity, but that changes after menopause. It becomes stiffer. Your bad cholesterol, like I said, goes up. Then you lose that good cholesterol. You get insulin resistance, so you have higher risk for developing diabetes. All those things happen after menopause.
Are there any preventative measures that a person can take to maybe not necessarily not have that experience? Because that, from what I'm understanding, that's something that we're all going to have to go through. But is there a way to remain? Is there something that we should be doing to maintain our health hard? I know diet, exercise, and please still expound on those. But what else is there anything, or is there anything that we can do to help combat that?
So I think that's a great question, actually, extremely great question. And that kind of segues back to what you mentioned about what we should be, saying with our providers as well. I think it's important as providers that we normalize the conversation around menopause.
Yes.
And it's important that we also, stress that, it's a turning point for a woman's heart health. So as providers, we should also be screening women for these cardiovascular risks that occur around menopause. And I think I mentioned to you, Trish, during our interview that it's unfortunate that only 22% of primary care providers feel well equipped to assess a woman's cardiovascular risk.
Break that down real quick. We got to take a pause there because this blew my mind.
Yes.
Please break this down, what you're saying.
Yes, and this was an article by Gina Lundberg at Emory and her colleagues. This was in 2017, and they did a survey. Only 22% of primary care providers felt, well equipped or comfortable enough to assess a woman's cardiovascular risk. But also, only 42% of cardiologists felt, yes.
Isn't that crazy?
Yeah.
42%
of cardiologists. But if you think about when it comes to heart disease in women, women are underrepresented.
Right.
They're underdiagnosed. They're undertreated. They're under-researched. So this is not a surprise. So this is something that we really have to, emphasize and work for. So it's important that since we realize these statistics, we as women, we need to be advocates for ourselves. We need to educate ourselves. We need to be our own advocate and be the ones to ask our providers, okay, what are my numbers? What do I need to do? So the American Heart Association has something called Life Simple 8.
Okay.
And it talks about lifestyle, so lifestyle is foundational. So to answer your question about what you need to do, it's all about lifestyle.
Okay.
That's foundational, which is extremely important. Of course, exercise. The American Heart Association recommends 150 minutes of exercise a week.
Okay.
So you can think about it like maybe 30 minutes 5 of the 7 days of a week. And if you look at it, so how many minutes do we have in a day? 1,440, right? And your heart is saying, please give me 30 minutes of that.
Okay.
So it's extremely important. And we have so much research around the benefits of exercise. You sleep better, your good cholesterol goes up, so many helps your blood pressure, helps with your blood cholesterol, so many important factors with exercise. So that's key. Then of course we talk about diet, low fat, low cholesterol diet. The American Heart Association really endorses the Mediterranean diet, which is, rich in whole grains, fruits, vegetables, and things like that. Also, sleep is extremely important because during menopause, I actually forgot to mention that in addition to those vasomotor symptoms and depression, anxiety, there's also a lot of sleep disturbances that occur with
insomnia.
Insomnia.
Can be a
Insomnia
problem.
is huge with menopause. And that in itself is actually increased for cardiovascular risk. So it's important that you get, maintain a healthy diet, exercise, get adequate sleep. And we always say, know your numbers. So when you talk to your doctor, you want to know, what is my blood pressure? What is my cholesterol? What is my blood sugar? So those are the things that you should know. And you want to take, make sure you take care of. And I also want to, talk about younger women.
Yes.
In the sense that we already know what happens with menopause. Your blood pressure is going to go up. Your cholesterol is going to go up. Your insulin resistance, so you can have issues with, diabetes. So when you now have these symptoms, these vasomotor symptoms and things like that, we'll get into talk about, hormone replacement therapy.
Okay.
If before menopause you already have these issues, you're really going to be shortchanging yourselves in terms of what options that you can have for treatment, because you already have these risk factors that might make some treatments for your symptoms that you'll be contraindicated, because if you already have diabetes or you have high blood pressure, you know, you don't have a lot of options when it comes to treatment. So you want to start making those changes early, because after menopause or during the menopausal transition period, your risks go up. So you want to make sure that you already are not coming into menopause with blood pressure issues, cholesterol issues. So you want to start making those changes now.
Yes.
But also remember that it's never too late. You know, so, and a lot of young people think, oh, yeah, I'll just worry about my heart later, I'll worry about that later, but later may be too late.
Right.
You want to start making those changes now, and it's never too, you know, early to start, never too late, you know, so it's very important to make those changes when you can.
Yeah, and I know you do. She does a lot of working out.
Yes.
She does, which I love. It's very inspiring. But one of the things that you mentioned about exercising, you had mentioned that you do yoga. I have an interest in Pilates. What type of does that 30 minutes look like? Because a lot of I won't say a lot, but some of my peers are now joining. We're all at the same place in life, and they're jumping into all of these what do you call it? Boot camps.
Yes.
And they're injuring themselves, they're hurting, they're discouraging themselves, they're hurting themselves. Does it take all of that to do this 30 minutes that you're talking about?
No, and again, if you haven't been exercising, you don't want to jump into boot camp.
Absolutely.
You want to take things very, very slowly. You might not be able to do the 30 minutes at a time. It might just be 10 minutes. And it's just simple. It could be something as simple as walking driveway, gardening, you know, dancing. These are all forms of exercise. You know, we recommend cardio, but you also want a little bit of strength training, because you definitely want to build muscle. It's good for your bone health. So you definitely want some strength training, so some light weights, but you don't have to do something like boot camp. It's simple. You start simple and you gradually build.
Yeah, that was my number one question, because I walk, and I've chosen walking but I do have to tone. I have got to tone. I'm speaking to myself right now. I've got to tone. But Jennifer, you have any other questions? Because I have several more. But
yeah, I work out quite a bit, and I've been working out for quite some time, because I tell people when they come to the class, I said, you need to start slow. And the toning, that helps, and the strengthening. But my doctor put me on because I was starting to get some bone loss. Obviously, this menopause causes that as well.
Absolutely, yes. And that's one of the other risk factors with menopause is you get osteopenia, osteoporosis. And so aside from hormone replacement therapy, because not all women can take hormone replacement therapy, there are medications that you can take to, you know, for bone health and bone loss as well.
Yeah, she gave me, I take I call it a super vitamin D. I take it once a week.
And that's good. That's vitamin D is important for bone health as well. Yeah, absolutely.
So now let's get on this old, ugly monster of HRT.
Yeah.
And I know it's more, we talked already, and I know it's a lot of stigma behind that. And so, and HRT is hormonal replacement therapy. And I won't say that I'm afraid of it. I just want to try other options before that. So break down our options. I'm trying to do the natural thing right now, but there are, because there are some people who are really suffering and they need to possibly consider that. But give your opinion on that.
So I want to say with hormone replacement therapy, it's not one size fits all. As you mentioned, there's a lot of controversy surrounding hormone replacement therapy. You know, the thought is that, okay, well, if the issue with menopause and the risk for heart disease is that you're losing estrogen, why don't we just give women back the estrogen? So in the 40s, what they were doing, they were actually using the estrogen in the urine of pregnant women, and that's what they were using to treat, you know, for hormone replacement therapy. And then that became expensive, so they started using it in pregnant horses. And what they found was that initially, at first, it was helpful for all these symptoms. Women felt better, but then they found that, you know, there was increased risk for endometrial cancer. And they said, let's take a step back. And they found out the issue was that if a woman has a uterus, you shouldn't just give unopposed estrogen. You should use progesterone. So that's when they started using estrogen and progesterone to
Okay.
help with women with symptoms, because it's probably one of the most effective treatment for the hot flashes is hormone replacement therapy. And then there came a point where there was an observational study called the Nurses Health Study, and it turns out that that study suggested, well, when we give women estrogen and progesterone, it helps their heart. And all of a sudden, prescriptions for hormone replacement therapy shot up. Almost 90 million women were on hormone replacement therapy.
Okay.
I remember when I was in training, anytime we present a patient, we'll say 50-something-year-old postmenopausal woman on hormone replacement therapy. We had to emphasize that we're trying to protect their heart by using hormone replacement therapy. That was based on observational studies. And around 1998, they did a study called the HERS trial, where they looked at women who had established heart disease. And they looked to see the effects of hormone replacement therapy. And it turns out, it's bad for the heart. Where they were seeing increased risk of blood clots, they were seeing strokes, they were seeing breast cancer, heart, conditions. And then after that, they now said, okay, what about women who don't have established heart disease? What about other women who've been getting this? And that's why they did, it's a huge landmark study. It was called the Women's Health Initiative. And they looked at, and I think 2002 was when that came out. And that also showed the same thing, that increased risk of breast cancer, heart conditions, and all of a sudden, prescriptions just dropped.
Wow.
So we went from 90 million women to nothing. And I remember having patients at that time who were on hormone replacement therapy and they were taken off, and they felt terrible.
Yeah, I
they
bet.
When they
felt
took-
awful.
when they-
Yes, when they took them off, they felt horrible. And so lately, we started looking at it again and said, when they did a sub-analysis of that women's heart study, they said the problem with that study is that most of the women who were in that study were way, way past that perimenopausal period. The average age in that study was 62 to 63. But we know the average age of menopause is 51.
Right.
So then they looked at that subgroup of women between the ages of 50 to 59, and they found that in that group there wasn't that increased risk for heart conditions as they were in the older population.
Okay.
So they started doing more studies and looking at that particular group of women, that first 10 years after menopause, what is the risk? And they found that there's no major risk. So now, when it comes to hormone replacement therapy, if you have a woman who's having a lot of hot flashes, who's tried the natural things like, black cohosh or all those other things, all those non-hormonal things, and they're still having these vasomotor symptoms, then you can look at hormone replacement therapy for them. But you have to look at what is their individual risk.
Yeah.
Meaning
I see.
that person. So that's why I said it's important that if you come into menopause very healthy, you don't have high blood pressure, you don't have high cholesterol, you're not overweight, and you don't have a family history of you don't have a history of breast cancer or anything like that, then it's considered safe for you for those vasomotor symptoms. And I can
Okay.
tell you it makes a difference in a lot of women,
Yeah.
who have very debilitating vasomotor symptoms. And we actually know that women who have a lot of hot flashes and recurrent hot flashes or frequency, they actually have increased risk for heart disease compared to somebody else.
Really?
Yes.
Really?
Yes. So we found that, and like I said, black women have more vasomotor symptoms.
Right.
So the more you have, or the longer you have it for, or how recurrent it is, you have a higher risk for heart disease. So obviously you want to treat those symptoms.
Yeah.
So that's hormone replacement therapy is good for that group of women.
Okay.
So a lot of times when you talk to your doctor, you definitely want to make sure you assess your risks. If you're going to take hormone replacement therapy, you want to take it early during menopause for a short amount of time and not after the age of 60. So before the age of 60.
Not after 60.
Exactly. Before the age of 60, within those first 10 years of menopause. But any woman who's over the age of 60 or more than 10 years after menopause, there is no benefit to taking hormone replacement therapy.
Okay.
And I do want to stress that we're not recommending hormone replacement therapy to protect your heart. So, we're not saying you should take hormone replacement therapy to protect your heart, but it can be safe in a certain subset of women who have debilitating symptoms that have tried other things and have low risk.
Okay.
Yeah.
And in saying that, I discussed this with you as well. When I went to my doctor, my insurance will only cover an HRT.
I see.
and she introduced me, just tried me on the trial of Veoza.
Okay.
I loved Veoza.
Yeah.
But my insurance would not approve it, and they want to force me into an HRT, and that makes me, because I have trust issues with insurance companies, you know, that makes me like, are you trying to guinea pig on me? You know, why are you stressing that so hard? So do you have any knowledge about the Veoza and how that works?
Yeah, so those are the relatively newer non-hormonal medications that have been used to treat these hot flashes and vasomotor symptoms. But of course, anytime a drug is new, it costs a lot more. So I think it's more from that standpoint.
cost.
The cost
Okay.
at this point is the main issue,
Okay.
because it's not generic. You
No.
know, yeah.
And they don't
versus
have a generic
generic
version.
version because it's
Yeah.
relatively new, and then you have the hormone replacement therapy. You have generic versions of them,
Okay.
and then aside from those newer ones, you have things like that have been around for a long time. We call them SSRIs. They're actually medications to treat anxiety and depression, but they've also been shown to improve vasomotor symptoms.
Okay.
And there's even some other medications that they're blood pressure medicines, but in a lower dose, they can treat vasomotor symptoms. So there are other options apart from the newer things like the Veoza in between that you can talk to your doctor about as well. And of course, those natural things that
Yes.
we talked about,
Yes.
natural things, and then lifestyle. If you smoke, definitely stop smoking. You know, eat right, and low sodium. Is very important. Those things are extremely important. Try to get enough sleep. All those things are important.
Yeah. It's funny. It's like a catch-22 because
Okay.
it's like, okay, you hit menopause, you're going to gain weight around your waist. You know, you're going to have these hot flashes. You crave, I don't know about anybody else, but I crave sweets like crazy.
It's part of
But
that
I can't
insulin
eat it.
resistance.
Yeah,
Yeah.
but I can't eat it because it's going to make me gain weight. It's going to make my
Okay,
blood pressure
okay.
go up. I can't watch my salt. It's just like, oh,
Yes,
good God.
yes, yes.
And do you have any other questions? Because we have a few minutes left, and
Okay.
I want her to end
Sure.
with encouraging us.
What can women over 60, because I'm over 60, can we
question.
take? Because now, periodically, I have hot flashes. And I notice it's kind of seasonal. Like I may go through a period of time and I'll have a lot of hot flashes. Then I go through a period, nothing. So is there something that someone over 60?
Yeah, so basically the only thing that we don't recommend over 60 is the hormone replacement therapy.
I see.
All those other non-hormonal things that we talked about are still options for women over 60.
Okay.
It's just that because women over 60, what happens, like we said again, is that estrogen can be protective, but when you start to develop plaque, it can worsen
Make it-
things. And the
okay.
older you get, the more likely that your arteries have already started developing plaque. So all of the other non-hormonal things are okay. The SSRIs, the Veoza, there are different things that you can use over 60, but just not hormone replacement therapy.
Oh, okay.
Yeah.
And what about the natural things? Because I heard yams were good.
Yeah, so
Is
they have there's some natural things, dietary natural things that are helpful. That there's certain things that are anti-inflammatory that are helpful.
Okay.
In terms of food, things that are helpful, and also things like black cohosh, estrogen. There are all these other things, herbs that are supposed to be
Estrogen.
that can be helpful as well. That people have tried. Yeah.
I love it.
Wow.
You got all your questions answered? That was a really good question.
Yeah,
by the
I'm
way.
trying to think of, so it's okay to take those natural things after 60.
Yeah,
Those
yes,
natural.
it's like natural or even other non-hormonal things.
Okay, okay.
It's really just after 60, the HRT is the main. Is the main thing that we have to consider.
Yeah.
So leave us with some hope.
Yeah, and speak to our ladies about
Yeah.
the importance. And you even touched on the younger you are.
Yes.
So even talk to those ladies so they'll know, okay, this is what to expect, but also you're in an area or a time where you can prepare for this time of life that's going to come.
Yes.
It's coming.
No, so I think, like I said, in terms of women before younger women, it's all about lifestyle. Because as we said before, menopause is a time of accelerating cardiovascular risk. So you want to take all the necessary steps before menopause to reduce your cardiovascular risk.
Yes.
And I think it's important that women know that menopause is not just about hot flashes. It's a wake-up call for your heart. Because as we said, it's a time of accelerating risk. So when you hit menopause, it's a wake-up call for your heart. But it's also an opportunity, So you should think about it as an opportunity when you have the right information, the right knowledge to be able to take the necessary things you need to do to decrease your risks.
Okay.
So you want to start educating yourself about how you can do that. And we talk about it with lifestyle, diet, exercise, maintain a healthy diet, exercise, make sure you know your numbers. Those are all the things that are extremely important, because at this point, this is a time that you can do those things and you can actually decrease your cardiovascular risk. It's an opportunity to decrease your cardiovascular risk. So it's extremely important. So you remember that your heart health is your power.
Yes.
So you've got to own it.
Yes.
You know.
It's a whole new way of looking at things.
It is.
It really is. But I want to thank you for coming and hanging out with us on set. We're going to look for that article coming out, but also
The article is already out.
The article is out. Okay.
It's on the risk of premature menopause on cardiovascular disease.
Okay, where do we
it came
find
out.
it?
It's a journal called Circulation. I'll send you the information on.
Okay.
It's a cardiovascular disease in women. That's the journal.
Okay.
But I'll forward that to you so you
Okay.
can have that.
Awesome.
You know? Yeah.
But thank you for coming and hanging out with me, guys. We're going to be right back.
Trish Standley TV Show.
I'd like to thank my guest today, Dr. Olubi, who came and hung out with us. And I don't know about you, but I learned so much from her. One of the points we were talking after set was that I failed to mention was that I wasn't sure of the symptoms that were occurring for menopause for me because I had experienced a hysterectomy. So if you're one of those ladies out there who have had a hysterectomy at a young age, you may not know, you don't have that 12-month gauge to go by. So it's going to be very important that you have this conversation with your primary care doctor and do all the testing and investigative research that you can possibly do. And if all else fails, reach out to Dr. Olubi. She would be happy and honored to help and assist you. Again, I want to thank my co-host, Jennifer Eichenberger, for coming and hanging out with me on today. And most of all, I thank you for always tuning in and always showing me and this show and this whole production love. Thank you, guys. I don't say it enough, but I do thank you. But as I always say, love isn't love unless you give it away. Give some love away today, guys. Thank you for tuning in.